everyone, welcome. It's Dr. Brooks with Healthy Kids Corner. This week we're going to touch upon allergies. This is a really important thing because so many kiddos have allergies and we don't really know what they're to. So I'm going to talk about allergy symptoms in general, both seasonal or environmental and food. I'm not really going to get into the different food allergies and what they mean and all that fun stuff. Maybe I'll do that in the future. But I kind of want to give the very basic overview of allergies and then maybe dive a little bit deeper into the rest at another time. I do talk about the different food allergies, IgG versus IgE, in my book, 15 Things Your Doctor Doesn't Know About Your Child. So if you want to read a lot more detail and have an understanding of that, you can see that there. So anyways, let's dive in. An allergy is an overreaction of the immune system to a substance that's harmless to most people. But in someone that has an allergy, the body's immune system treats the substance, also called an allergen, as an invader and causes an overreaction, causing symptoms. So these allergies can be in the environment, pets, food, etc. In an attempt to protect the body, the immune system of the allergic person produces an antibody, and those are called immunoglobulins. Those antibodies then cause the allergy cell in the body to release chemicals into the bloodstream to defend against the allergen. This means that every time the person eats or is exposed to that particular allergen, he or she would have an allergic reaction or a symptom. Many parents don't know what the real allergy symptoms look like other than what we know as anaphylactic reaction, right? I'll hear from a lot of parents, well, they don't get a rash when they eat that, or they don't get a rash when they're exposed to that. And that's the traditional way that parents have been taught an allergy looks like or exposes itself. And that just quite simply isn't true, which is why I wanted to do this video. So let's talk about some common symptoms that we see with allergies, or that I see that you may not and you can watch out for in your children. Okay, so what symptoms do I want y'all to be looking for? Traditionally, like I said, people think of the common allergic reactions that involve your eyes, your nose, your throat, and your lungs. They're often told to ignore any skin or gastrointestinal symptoms. So that's what I want to touch upon right now. The GI symptoms can go unnoticed and show in things like picky eating, stomach pain, failure to thrive, which is basically that they're not gaining weight and it's gotten so bad where they're not thriving anymore. Poor eating, overeating, posturing, which, let me explain what this is. Posturing is when a child will do things like hang over furniture or push things into their stomach. I have some children that sleep with blankets between their legs. Also posturing on the toilet, so squatting on the toilet instead of sitting on the toilet. In addition to the posturing, you'll see poor sleep, behavioral problems, mood swings, eczema or other rashes that are unexplained. And those are just a few that I see that have, quote, allergies. Now, mind you, nothing that I talked about involved a throat swelling or a full body rash type of anaphylactic reaction. So what are your options if your kid has some of these symptoms? Allergies in children are on the rise, and we know that, especially when it comes to food. And in many cases, we can help them naturally. So chiropractic care and nutritional oversight are probably the best things that you can do. Of course, I do a functional medicine approach in addition to my chiropractic practice, and that's really the nutrition and diet and supplement components. So if you're in our area, we'd love to see you. If not, I would start doing a search for doctors that do those types of things. Because the environmental allergies and sinus problems can be relieved with chiropractic adjustments, because that works to really balance the immune system and relieve the symptoms. On the other hand, nutritional deficiencies and food allergies cause poor immune function, and that can also be helped with managing through diet changes, food testing, and supplementation recommendations. So this is just, I think it kind of makes a nice little team of things that you can do for your child. I want you to read more about chiropractic and allergy relief in the study that I have posted on our website. It was chiropractic care of a pediatric patient with asthma, allergies, chronic colds. So you can go to our website at www.mychildwellness.com and go ahead on the homepage. You can scroll down and click on allergies and you'll see the study there. So there is some research to back up not only chiropractic care, but also the nutritional components that a lot of children are suffering with, as well as food, of course. So I hope that helps. If you'd like more information and education as a parent, You can attend any of our webinars free every month. If you're a clinician and would like to know more information on the clinical side, I do those as well once a month. All courses are put on the www.dramberbrooks.com website. Just click education and you can see the list. In addition, we have posted all of the webinars that we have recorded so that you can listen to those if you so please. Also, we're on Facebook at Whole Child Wellness, so like us there because I post lots of great information that you can pass on to family, friends, and if you're a clinician, pass it on to your patients. We are on Twitter at WholeChild4U, and of course on YouTube at Whole Child Wellness. So I hope that helped in answering some of your questions. I wish you the best in health and happiness. See you next week. Bye.